We do have the good doctor with us right now. Dr. Eugene Cherny is here from Heartland Plastic Surgery, and we are talking about some things that you do. Obviously, you're a plastic surgeon, and there are some new things that are coming out that we want people to know about.
There's always new stuff happening, and so I thought I'd just have a little summary of like the things that are on my radar now that are new. First thing is, you've heard about the Cool Sculpt, the freezing of the fat.
We've talked about that.
We have, and now there's a new fat freezing handle. You have to make it has to be specially designed so that it fits a certain area. So now there's one. I'm getting it done. So it'll pinch up your neck fat and it'll shrink that fat neck further.
Because right now you're hearing it for tummy, you're hearing it for thighs, your back end, things like that, big areas that those suction cups basically can fit on. But now you're saying there's more delicate areas that they're constructing it for. We're
going to see it coming for this, and then down the road it's going to be for the arms. A lot of people like having big time, because there's so many.
A little clamp on there. Is this going to clamp on like that, or?
Well, there's like a suction thing that it has to be sucked into the freezing chamber. So that's so it operates
like a vacuum cleaner tube. Like a hose from a vacuum cleaner?
Yeah, we ought to do it on you so you can be here with like a nice hickey on that neck.
All right.
For the next time you're on TV.
It kills the fat cells below the skin, and basically.
I was going to say, if people don't remember that segment, kind of refresh everybody about exactly what it does.
Right. What the Cool Sculpt does is because it's a very cold application, the skin has better circulation than the fat does. So the skin lives, but the fat dies.
Okay.
That's how it goes.
That's a good explanation.
Now, if I stood outside in a blizzard, could I achieve the same effect? Probably not.
Now, here's what we're talking about.
The doctor is staring at you with a very confused look on your face.
I get that look
I'm trying to come up with a comeback. Well, there it is, and this is just further advancements are yet to come. And so this is new. And then the thing that's going to be interesting. There's something that might be good in conjunction with this for better shaping, and that's the new injectable drug. It's called Kythera. Kythera is a new injectable drug. It was just approved by the Food and Drug Administration that you can inject, and that melts the fat. And that's a whole other thing. You'll be able to inject it in various ways and maybe have a more of a sculpted outcome. So that's coming down the line. I'm waiting to hear from my rep from my company so I can get my hands on it.
It'll melt the fat and then you just eliminate it then.
I was going to say, where's the fat go?
Well, just like with the fat freezing, it's dead and the body just gradually reabsorbs it and it's gone. The body will heal it.
I need a 2-liter bottle of that stuff.
Me too.
I mean, how, really? I mean, can you do that anywhere? I feel like that could get dangerous. No?
Well, that's why it's only approved for usage in the neck. Because that's where it's been shown to be safe and effective in the neck. It's gone through all the government regulations. And government regulations, all this stuff is so expensive.
Right.
Because they have to prove it like 10 times over that it's safe. That's how it is in the United States.
So it's a targeted zone right now, and it's your neck.
Targeted for the neck, but I guarantee you that eventually it will be approved for use in other areas of the body.
And how long of a period of time does it take once you get an injection for you to, have they determined how long it takes?
I haven't got the full briefing, but it probably dies within the fat probably dies within a day or two, and then it probably reabsorbs. With the assistance of massage and stuff like that. There you go. All Kybella, Kythera Corporation makes it. Kybella is the name of that. See, that's what I'm talking about. You can, for more complicated necks, where you have to target it differently. Yes, eventually it'll be good for other parts of the body, but it just needs more development.
What's the timeline on that if people are hearing this and are interested?
I think, well, it's okay now. I just got to go physically grab my representative from that company. Chris from Allergan, they also make Botox and things. So that company acquired this so that they could market it aggressively.
Wow.
He's coming to my office this week. I'm
sure he'll be happy
to talk
to
about.
Speaking of Botox, you mentioned that there's a cream now too, correct?
This is coming. This is in the third stage of Food and Drug Administration approval. You'll be able to just apply Botox as a cream, no shot. It will sink through the skin and paralyze the muscle without having a shot.
Okay, so
that's going to be awesome.
How effective is that going to be as opposed to getting the shot?
Well, the way this is going to go is, we've had ongoing improvement on ways to apply drugs. A lot of drugs now come as patches. We're learning how to get stuff through the skin now better. I'm waiting for the day when numbing medicine when I don't have to give somebody a numbing shot anymore, when that numbing medicine really works well. Now this is, they found a way to penetrate the Botox through the skin into the muscle. Here it's going to be just for crow's feet at first, because this is super thin.
Right.
So they haven't got to go very far to get down to the muscle.
Right.
And crow's feet is actually one of the best applications of Botox. I think it's fantastic because that's something there's no good surgery for. So for people who have excessive wrinkling, there with smiling, it's just a matter of applying the cream the right way.
So, and that's kind of the overarching theme today, is you're not having to cut to do a lot of this stuff now.
The whole overarching theme, absolutely right. What all I see is like methods to do things with less invasiveness and greater effectiveness. Absolutely. That's
and faster recovery, I imagine.
Oh yeah, big time. That's what it's all about. So yeah, without the shot, you won't have the risk of the bruising or these other little minor problems that people get from this area. And a lot of people are scared of needles. I mean, a lot.
Yeah.
I bet like 10 times more people will get it done if you don't have to have the shot.
There you go.
Very true.
Now, I also mentioned that other things that are new in plastic surgery. You mentioned some implants.
Yes, breast implant technology is really jumping forward in leaps and bounds. And now we have, you may have heard of them in the past, it's called the gummy bear implant.
Gummy bear?
Gummy bear, because they feel like a gummy bear, they're firmer, but they maintain their shape exactly perfectly. So now they make them in more natural shapes. This has really revolutionized my breast reconstruction practice, because back then, in early breast reconstruction, you were just lucky to kind of get something that kind of looked like a breast. Now they come in shaped implants where it really looks a lot more like a breast. And it's much more natural, much more realistic. And there's great applications for this in certain kinds of cosmetic surgical situations where the implants are shaped. And these are interesting because they can lift that lower breast a little better. And interestingly, at this time, women are choosing smaller implants, and it seems like the trend in our American society today is for a more natural outcome with breast implants than before.
Have you installed any of these yet or not?
Yes, I have, and they're very interesting. The keys, like anything, is like finding who's going to really benefit the most from them. I think it's going to be the best for the mommy makeover breast that has a little bit of drooping because of the baby, and then but this is going to just lift and shape.
How many different styles do you have of implants for this purpose?
Oh my gosh, there's so many different kind of implants, and that's really the key, is choosing the implant well, choosing it correctly. There's hundreds, actually.
Really?
They make hundreds of different implants in every conceivable shape and size.
And that's about having a conversation with a doctor and finding someone you trust and
yes, ma'am.
Get those options out on the table.
That's right, Jackie, yes.
And if people want to come over and have a chat with you, what's the best way to do so?
I'm over by the Girl Scouts. I'm on Hickman Road, and yes, heartlandps.com. We'll be having a party and an open house coming up. We'll probably be doing free mini consultations. That'll be in December, and but we are doing free consultations for the rest of the year. So check it out.
HeartlandPS.com. Check them out.
Thank you, Doctor.
Interesting and very neat things that are going on.
Always something fun going on in plastic surgery.
Well, you always hear about things happening on the coast. It's interesting that we're getting it when it's hot right now, right here in the middle of the country. So.
It's getting that way, and I like it better that way.
And you're on top of it. Good job, my friend. Give me 5.
Thank
there you go, buddy. Thank you, sir.